morning.
Good morning.
I'm Cheyenne. I'm the student nurse today. Could I grab your name and date of birth, please?
Yep, my name's Sue Smith, 7/14/70.
Perfect. Alrighty. So today the doctor has me doing a respiratory assessment on you. He just wants me to listen to those lungs and just kind of ask you a few questions.
Okay.
A few ways that you could participate would be just sitting maybe at the edge of your stool when I have to listen, and just stay on the quieter end when I do listen to those lung sounds.
Sure.
Okay. All right, so I washed my hands. The next thing, we're just gonna dive into your history. So for respiratory disorders, have you maybe had any lung cancer, COPD, asthma, emphysema, anything along those lines?
No.
Okay. Next will just be present symptoms that you could be displaying now, or maybe you have had. Maybe some shortness of breath, wheezing, coughing, maybe just having a hard time breathing, anything like that?
No.
Okay. Family history. Do you know anybody in your family who's maybe have anything like that?
Not that I'm aware of.
Okay. Next will just be presence of diseases. So maybe chronic heart failure, maybe things such as cystic fibrosis or MS, anything like that?
No.
Okay. Next is going to be lifestyle habits. So are you maybe a smoker, or alcohol, diet not the greatest, exercising, problems along those areas?
No.
Okay. Next is going to be occupational and socioeconomic. So occupational is where you work. Do you maybe work in a factory or a farm where you're inhaling toxins or chemicals?
I do not.
Okay. And then socioeconomic could be like if you're homeless, or if you're inhaling a lot of pollution, or maybe secondhand smoke.
No.
Okay, perfect. And then lastly is medication. So are you on anything like any albuterol, inhalers, maybe taking steroids, or on a CPAP machine?
I am not.
Okay, perfect. So now we are going to dive into the actual assessment. So the first thing that I'm going to do is just inspect your thorax area. So here I'm just looking at your overall symmetry, and it looks very symmetrical. I'm not seeing one side raise higher than the other. That could indicate a collapsed lung. I'm looking at the quality of your respiration, so the rate, the depth, everything looks normal. It's good. I don't see you having any like labored breathing, like distressed, or using accessory muscles to help you breathe. You look calm, and just your breathing looks very well.
Okay.
So then next I'm going to go into palpating. So I'm going to ask you to rotate, and then I'll go on the back of your chest. So the first thing I'm going to do, it's called palpating, and it's going to be excursion. So with excursion, I'm putting my thumbs right here at your 10th intercostal space, and I'm going to ask you to take a nice deep inhale, exhale for me.
Okay.
And one more time. Perfect. So with that, my thumbs moved 1 to 2 centimeters as you inhaled, and that displays equal lung movement between your lungs. Okay, so that's good. The next thing is called tactile fremitus. So each time I move my hand down, you're just going to say 99 for me whenever you're ready.
99, 99, 99, 99.
Okay, so with that, I was feeling for a vibration. The vibration indicates, like if you had a higher amount of vibration, that would indicate fluid buildup, so maybe pneumonia. And then if I wasn't feeling as much vibration, that could indicate maybe obstruction in your lungs. But I was feeling a very good amount.
Okay.
So that's good. While I'm back here, I'm going to go ahead and percuss at each lung site. Okay, so with percussing, I'm tapping like this over each lung site, and I'm listening for resonance, which is what I heard all back here, and that's like just like a hollow sound, like a normal air-filled lungs, how they should sound. If I were to hear hyperresonance, that would be like a higher pitch sound, maybe some fluids in there, and then dull would be like a muffled sound, and then flat would just be a flat sound over each site. Okay, and then now I'm just going to auscultate over each area. So if I could have you just inhale and exhale for me.
Okay.
one more. Okay, perfect. So your lung sounds sound clear. Up here I heard bronchovesicular, so that's like a medium pitch sound, and that displays equal inhale and exhale. And vesicular I heard down here, so that's like a low pitch sound, and that has a short inhale and long exhale. Those are all normal lung sounds, which I did hear from you.
Okay.
I'll ask you to go to the front side now.
Okay.
All right, so I'm gonna do the same thing on your front. I'm gonna be percussing.
Okay.
So I'm just gonna go ahead and percuss over each lung sound. And then I'll go underneath here and the side, yep. And then if you wanna keep this up, I'll hit that third middle lobe. All right, perfect. So again, I did hear all resonance, so that's that normal air-filled sound that you wanna hear, so that's good.
Okay.
Now I'm gonna go ahead and auscultate, so I'm gonna listen to your lung sounds.
Okay.
Have you take some deep breaths. And then I'll go underneath here. Go ahead. And then underneath this lobe. Okay, so I heard all normal lung sounds very clear. Up here I heard bronchovesicular, and then down here vesicular, as well as underneath the armpit vesicular, and those are all normal lung sounds.
Yeah.
If I needed to, I could listen up here, and that would just be bronchial, so that would be like a Darth Vader sound, more hollow.
Okay.
That would be if we needed to listen to that. So then I heard all normal lung sounds from you, which is good. If I were to hear something abnormal, I'll go over a few of those with you. These are sounds that you wouldn't necessarily want to hear. We would have to look more into if we did hear them. So the first one would be crackles. So that kind of sounds like leaves are crunching.
Okay.
And then we have wheezing. So that's mostly in patients with asthma. That's like a high-pitched musical sound.
Okay.
And then we have stridor, and that you hear with children in croup, with croup, and that's again like a high-pitched sound.
Okay.
And then you have pleural rub, and that's kind of like your lungs rubbing together because it lacks that fluid that needs to be in there, and it causes like a grating sound, or like when balloons rub against each other. And then you have diminished and absent, which is simply you don't hear it, or maybe you kind of hear it, so it's very hard to hear. And then bronchophony is like a muffled sound, and you hear that on 99. And then egophony is heard on EE, but the patient, when you're listening to it, it kind of sounds like an A. That would indicate that they have egophony. So those are all, again, just abnormal. And then another one, is bronchi, and that sounds like a snoring sound, like as if someone was snoring.
Okay.
So again, all abnormal lung sounds, but I did not hear any of that on any spot in your lungs, so that's good. So lastly, I just kind of want to look at you again and kind of just observe your color, your temperature, and your general appearance. So your color to me is normal, it's pink. You're warm. Yep, you're warm. And you look very relaxed. You don't look tired or out of breath or distressed, or displaying maybe that you're having a hard time breathing. And then if I were to see something abnormal, that would be cool to the touch. You would be blue, your lips would be blue, that'd be cyanotic, so that would indicate low oxygen. And your general appearance would just be very distressed, tired, and weak, and having a hard time breathing, maybe gasping for air. But I'm not seeing any of that on you, so that's good. All good things here. Did you have any questions at all for me or concerns?
No, I don't.
Okay, perfect. Thank you.
Thank you.